Welcome to Hand in Hand's medication process training. Every effort has been made to ensure the accuracy and completeness of this policy at the time of release. The information provided, including in any associated training, is for educational purposes only regarding Hand in Hand's medication processes. It does not replace professional medical advice, and all prescribing and clinical decision making remain the responsibility of qualified medical practitioners. Medication charts. Hand in Hand provides support to participants who may require assistance with their medication administration. When assistance is required, the participant will be provided with a long-term medication chart and a clarification of purpose of medication form that must be completed by a medical practitioner. Medication chart requirements. Medication charts are a legal document and must be completed accurately at all times. Staff must sign the medication administration record MAR in black pen immediately after administering medication. Any refusals, missed doses, or withheld doses must be documented using the designated dose emitted codes located on the back page. Red pen should be used where available. Front page of the medication chart. Staff may only input information into the blue sections. Photo identification must be updated every 12 months. The date the photo was taken must be recorded to ensure timely updates. Participant details must be entered, along with the date the participant provided consent for medication administration. Allergies and adverse drug reactions. This section may only be completed by a qualified medical professional. Completion of this field is mandatory for risk mitigation. Where possible, the nature of the reaction and the date should be documented, as this information may influence future therapies and help distinguish between a true allergy and an adverse drug reaction. Medication chart guidelines. Support workers are authorized to complete the following sections of the medication chart. The blue section on the front page, including client details and special consideration sections. The specific administration times, in accordance with the prescribed medication instructions. For short-term medication only, the time and dates, ensuring they follow the prescribed instructions. Signing for medications in the corresponding date and time fields immediately after administering medication to participants. The following must only be completed by a medical practitioner. Medication name, start date, stop date, dose, route, frequency, indication, max dose in 24 hours, special instructions, prescriber signature, allergy and adverse reaction information. Short-term medication is prescribed for a limited duration to treat acute conditions like infections, injuries, or chronic illness flare-ups. These medications have a defined start and stop date and are intended for brief use, such as a course of antibiotics. PRN medication from the Latin pro re nota, meaning as needed, refers to medications that are taken only when necessary, rather than on a regular, scheduled basis. These medications are typically prescribed for intermittent symptoms or conditions, such as pain, anxiety, or nausea, which may arise sporadically or during flare-ups. Regular medication refers to prescribed medicines that a person needs to take consistently at scheduled intervals, usually on a daily, weekly, or monthly basis, to manage a specific health condition or maintain overall well-being. These medications are often part of a long-term treatment plan and are intended to be taken at regular times, as instructed by a healthcare provider. Please note, a participant's medication chart should be a current, accurate, and reliable record of all their medications. This should include all prescription and non-prescription medications being used by the participant. Short-term medication. A participant's medication chart should be a current, accurate, and reliable record of all their medications. The medication chart accommodates up to 2 weeks of recording per medication instruction. If the medication is needed beyond this period, the participant must undergo a review by the prescribing doctor. If a participant receives a short-term medication order remotely, via phone or online, an additional medication label may be requested from the pharmacist. This label should be affixed to the short-term medications section of the medication chart. If an additional label cannot be obtained, it is essential to report this to your supervisor immediately. Please note, no medication can be administered without proper documentation and authority. Observe the participant taking the medication to ensure it is swallowed, chewed, inhaled, applied, or absorbed as directed. Then sign the AMAR in black pen immediately. Staff must record any withheld, missed, or refused medications in the chart, using the dose omitted codes shown on the back of the medication chart. It is recommended the dose omitted codes are written in red pen. These codes are located on the back of the medication chart for reference. The back page of the medication chart provides recommendations for terminology, abbreviations, and symbols used in the prescribing and administration of medicines. It is encouraged for staff to use 24-hour time format. A conversion table is available for reference on the back page. Documentation requirements. Any changes to a participant's medication chart or clarification of purpose of medication form must be shared with hand-in-hand management. Hand-in-hand disability support are required to maintain current and accurate documentation of participants' prescribed medication. Participants' medication documentation is accessible to employees via ShiftCare under Client Documents. Transitions of care between home and hospitals. Hospital admission. When a participant is admitted to hospital, staff must provide the hospital with the following: medication chart of the most up-to-date copy to ensure hospital staff have a clear record of current medications. Clarification of purpose of medications COPM form to explain why each medication is prescribed and its intended use. Participants' medication provided in a dose administration aid DAA or in the original box or bottle to prevent errors. Medicare card or healthcare card for hospital admission and billing purposes. Relevant behavior support plans or health support plans such as mealtime management, PBSP, seizure action plan, etc. Details of assistive technology, if required, including instructions or photos where possible, to ensure correct use. Discharge from hospital. Hand-in-hand disability support employees must ensure changes to the participant's care needs or medication are understood before leaving the hospital. With participant consent, employees should request written information about follow-up care to avoid miscommunication. Documentation and information to request from the hospital may include discharge summary, a summary of the medical care the person received in hospital, any needed follow-up such as outpatient services or allied health services and medication. Care plan or discharge plan, a detailed discharge plan for follow-up appointments with medical specialists, care recommendations for the person's regular healthcare providers such as their GP, and any other required health or social requirements. Medication summary, a list of current medications, including information about any new or changed medications and dates for the next medication review. Any medication changes should be documented in the participant's medication chart and clarification of purpose of medication form. Prescriptions for medication and, if required, dispensing of medication. Medication storage. All medication must be kept in sealed dose administration aids DOS, such as Webster packs, roll packs, or blister packs, or in the original box or bottle. Staff must check that all medication packs are correct, sealed, and not tampered with. Medication must be stored in a secure, dry, and cool place at all times. Medications that require refrigeration must be kept between 2 to 8 degrees Celsius, and the temperature must be recorded daily. All Schedule 8S8 medicines must be securely locked, reconciled at each shift, and disposed of via the pharmacy using a surrender of medication form. The 5 moments for hand hygiene: before touching the participant, before a procedure, after a procedure or body fluid exposure risk, after touching a participant, after touching a participant's surroundings. Hand hygiene for medication administration. You must wash your hands prior to assisting the participant with the support and/or administration of their medication, ensuring you follow all infection control measures. You should follow these 6 steps to successful hand washing. 1. Wet hands. Start by wetting your hands with clean, running water. 2. Apply soap. Dispense an adequate amount of liquid bar or powdered soap to cover all surfaces of the hands. 3. Lather. Rub palms together to generate a rich lather, then interlace fingers and rub the interdigital spaces. 4. Rinse. Rinse thoroughly with clean water to remove soap and any remaining contaminants. 5. Dry hands. Pat hands dry using a single-use paper towel, as cloth towels should be laundered appropriately. 6. Dry hands thoroughly. Ensure hands are completely dry to prevent bacterial growth and transmission of infections. Support workers' responsibilities. Support workers employed by hand-in-hand disability support may only provide assistance with orally or externally applied medication, unless specific training has been provided by a qualified healthcare professional. When assisting participants with medication support, staff must never provide support or administer medication beyond their skills, knowledge, and training. Receive adequate training in medication management and be confident in performing the assistance required. Undertake participant-specific training prior to administering medication. Ensure that all day-to-day practices align with the training and guidance they have received. Staff must always follow the 13 rights of medication: the right person, the right medication, the right dose, the right route, the right time, the right effect, the right documentation, the right reason, the right expiration date, the right to refuse, the right education, the right assessment, and the right evaluation. Clarification of purpose of medication form. This document details the reasons why medications are prescribed. Under the Disability Services Act 2006, some medications could be considered chemical restraint. NDIS providers have obligations under the NDIS Act 2013 to ensure that people with disability who are administered medication for the primary purpose of influencing their behavior are further supported with positive behavior support strategies. This is a live document and must be taken to every doctor's appointment for any required changes to be reflected. Medication prescribed in the medication chart regular and PRN must be recorded in the clarification of purpose form, detailing the purpose of each medication. Here's an example of a clarification of purpose of medication form. Staff may complete the participant's name, date of birth, and address on the front page. A medical practitioner must complete all other sections. The reason for medication must have one box ticked per row. A medical practitioner should sign and date the form, including the practice stamp or practice details, including provider number. Consumer Medication Information (CMI). Medication information can be provided directly by the participant's pharmacist or through written material, such as a Consumer Medicine Information (CMI) leaflet. CMI leaflets contain information on the safe and effective use of prescription and pharmacist-only medications and include the following information: name of the medicine including brand name and generic name, active and inactive ingredients, dosage of the medicine, what the medicine is used for and how it works, warnings and precautions such as when the medicine should not be taken, interactions the medicine might have with food or other medicines, how to use the medicine properly, side effects, what to do in the case of an overdose, how to store the medicine properly, name and address of the sponsor, date the CMI was last updated. Hand-in-hand disability support encourages staff to review CMIs whenever administering medications to ensure safe and informed practices. CMIs can be sourced from the following locations. Participant files. Some CMIs are stored in individual participant files, particularly for regularly prescribed medications. These can be accessed on ShiftCare under Client Documents. Pharmacy-supplied documentation. When new medications are dispensed, pharmacies often provide printed CMIs for reference. Online sources. If a physical copy is unavailable, CMIs can be accessed through reliable online sources such as the Therapeutic Goods Administration (TGA) website, pharmacy websites, NPS MedicineWise. Medication incident response. How to respond to a medication incident. Stay calm and keep the participants safe. Emergency? Call 000 straight away. Not an emergency? Call for medical advice GP, pharmacist, Poisons Line or 13 Health. Tell your team leader/management immediately. Write it in the participant's medication chart and shift report. Fill out a medication incident report within 24 hours. A medication incident is any event where the expected course of events in the administration of medications is not followed. It can include the following: medications given to the incorrect participant, incorrect medication being given, incorrect dose being given, incorrect time of medication, incorrect route of medication, spilt, dropped, or damaged medication, out-of-date medication, missing medication, lack of documentation such as medication not signed for, medication not given without instruction from the doctor or request from the participant, breaches of hand-in-hand disability supports policy and guidelines, participant refuses medication, incorrect storage of medications, incorrect supply of medications from the pharmacy. Medication Incident Report. Reporting medication incidents is essential for participant safety, compliance, and continuous improvement in care practices. It allows for immediate action to minimize harm, prevent adverse reactions, and helps identify recurring errors to improve medication management. All medication errors must be documented by completing a medication incident report within 24 hours. Medication incident reports can be accessed via the hand-in-hand Jotform app. Staff must never correct or overwrite another worker's entry. If an error is identified on a participant's medication chart, highlight it with a yellow highlighter so all staff know it has been recognized. The error must then be reported straight away using the medication incident report form. This process ensures transparency, prevents duplication, and supports continuous improvement in medication safety. Schedule 8 medicines. Schedule 8S8 medicines are classified as drugs of dependence and carry significant risks. It is essential for staff to understand their professional obligations when managing and administering these medications to clients. While S8 medicines provide important therapeutic benefits such as severe pain relief for cancer and major surgeries, and the management of attention deficit/hyperactivity disorder ADHD, they also have a high potential for misuse, abuse, and dependence. Due to these risks, their use is strictly regulated under the Drugs, Poisons, and Controlled Substances Regulations 2017. Please note, it is a criminal offense to possess a Schedule 8 medicine unless authorized. Strict adherence to these procedures ensures compliance with legal requirements and promotes the safe management of S8 medications. When a participant requiring medication administration support is prescribed a Schedule 8 S8 medication, staff must complete a daily checking and reconciliation process. This will include the number or amount of the S8 medication received will be recorded on the medication count sheet. Each shift, the number of S8 medication administered will be checked and documented on the count sheet. The information will be recorded on the participant's medication chart. Any discrepancy must be reported via a medication incident report and escalated to management immediately. S8 medication is locked and stored away. If the S8 medication is ceased, any remaining medicines must be returned to the dispensing pharmacist for disposal and a surrender of medication form completed. Medical advice, guidance, and support. Who to contact if you are unsure, need assistance, or require medication advice. For medical advice, GB, pharmacist, Poisons Hotline, 13 Health, Emergency 000. For support and guidance, Team Leader, on call when outside of business hours, hand-in-hand management. Participant self-administration of medication. Participants are encouraged to self-administer their medication whenever it is safe and appropriate. A risk assessment must be completed to confirm that self-administration is suitable. If a participant chooses to self-administer but does not meet the requirements outlined in the risk assessment, staff must refer to the participant indemnity risk form. This form details the risks involved and confirms that the participant understands and accepts those risks. If staff have any concerns about a participant's ability to self-administer safely, they must complete a medication incident report within 24 hours. Staff training and competency in medication administration. Workers must not administer medications until they have completed all required training and have been assessed as competent by hand-in-hand disability support management. Medication competency is achieved by satisfactorily completing the following: annual mandatory training, successful completion of the medication management online training module through National Disability Services NDS training, on-the-job training, participation in buddy shifts with an experienced team member, including practical observation and assessment, internal training and assessment, completion of hand-in-hand medication process training video, followed by a competency assessment to confirm knowledge and understanding of hand-in-hand medication procedures. Policy review. Familiarization with hand-in-hand disability supports medication management policy, accessible via the ShiftCare document hub and the office. Thank you, hand-in-hand team. We would love to hear your thoughts, suggestions, or concerns with anything so we can improve. Your thoughts are always valued and respected at Hand-in-Hand Disability Support. Please feel welcome to share your feedback by scanning this QR code.